Greetings all. Welcome to another episode of the Enterprise Edge podcast. This is Mark Figueroa, founder and CEO of the Enterprise Edge. Thank you for being with us once again. I am thrilled this afternoon to be joined by Dr. John Oberg. He's the founder and CEO of Precina Health. We're going to have a scintillating conversation today about where enterprise tech and enterprise AI is going in the healthcare space, but also more broadly. Some major technology players are going to be part of the conversation, such as Salesforce and Agentforce. And as always, as we go, if you have any comments or questions, please drop them in the comments field, and we will follow up with you and continue the engagement and the dialogue, and hopefully in a way that's productive to you and your businesses. But before we jump in, let's give John a proper welcome. John, thanks for being with us today.
Yeah, thanks for having me. I'm really excited to be here.
Great. Looking forward to the conversation. All right, well, guys, let's jump in. I think those of you who are regular listeners of our podcast, you know that we try to start out with some icebreakers just to get to know John a little bit, and we'll talk a little bit about his business, in some of the innovation that he's driving in the healthcare space. And then we'll conclude with a speed round, and that'll wrap the episode. So why don't we start, John? I've done a little bit of research on you. You've had a very intriguing path, professionally speaking. We're not going to have time to get into all the twists and turns, but I'm intrigued, and we'll have to follow up at some point. But let's just say that you've had some very strong experience in business and entrepreneurship and investing. Yep. And I'm not sure I'd call it a pivot, but I definitely say you sort of doubled down in the area of diabetes care and healthcare. Yeah. And I'm just wondering, is there like a succinct summary or maybe a couple of sentences that describes kind of what went into that pivot, what went into that decision or set of decisions where you thought it was your calling to, your vocation, if you will, to focus in this specific area of diabetes care?
My whole career has been focused on, human behavior and how to get people to, whether it's organizational change, which I've done a lot of in my career, but it really was about, people's willingness to change and then the ability to change and how do you take them through a change. And so that came to a head in, 2019, 2020. My wife and I were visiting her mom in rural South Carolina. I was working in the healthcare industry. Her mom had a diabetic episode that landed her in the hospital. It was totally avoidable, should have been fixed with a couple doses of insulin. Instead, It probably cost the taxpayer $100,000 in a hospital stay. And I was just really frustrated, and not by her doctor. Her doctor was amazing, but the system really was set up in a way that didn't really help the patient. And so I called my friends at USC and I said, hey, look, I want to come back. I want to get, I want to get a doctorate, and I want to solve type 2 diabetes. And I think that a long conversation made short was, that's cute. We've been trying to solve type 2 diabetes for decades in this world. We'll take your tuition, but you're not going to solve the problem. And so fast forward, I tapped my partner, Dustin Williams. He's an MD. And I said, let's go do this thing. We had a pilot study. We took 50 patients who were very sick from rural and low income area of the country. And 12 weeks later, 49 out of 50 patients who were very, very sick, we had fully controlled. One of them had an autoimmune disease they couldn't get into control. And we kept 83% of those patients in control for the next 2 years. And so I went back to my team at the university and said, what do you think? And their jaws dropped. They're like, what's happened here? And it's like, well, we found a way to do it. And so Dustin and I opened up a medical practice where he handles the medicine, I handle the behavioral health. And we have a way of assessing a patient that takes them through a process that gets them very healthy very quickly. And so you look at things like a GLP-1 that might lower an A1C by 1% over the course of a year. We lower A1C by 1 to 1.5% per month. And so it's just a new way of practicing medicine and behavioral health that works.
No, it's inspiring, John. I mean, without getting into details, I mean, I've got a lot of opinions based on my own life experience about how badly healthcare in this country needs to be disrupted in many ways. And I'm inspired by that. Just that beginning salvo. It's very inspiring. So I applaud you for that. and technology is an enabler, right? In many ways, and especially in this day and age with AI at the pace that it's growing,
Yeah.
I think healthcare has some of the most compelling use cases that I've seen for specifically agentic AI and certainly other types, but also agentic. And so, I've read some of your stuff and I've seen some other voices and
Yeah.
commentary that you've offered into the market, and I think you've talked about, patients, thinking about patients differently, patients as in the plural of patient,
Yeah.
not
Yeah.
patients as it, yep. And you've talked about them as, um, you know, uh, just treating them differently than they've historically been treated. And some of the challenges that have existed in healthcare, dealing with payers and referring providers and insurance approvals and all these different things. And I'm just curious when you think about, and maybe this is a good time to bring in Agentforce and what Salesforce is doing, but there's a lot of what I might call drag in the process. It's like to your point about the system, there's a lot of drag in the system. There's a lot of
Yeah.
friction in the system, and I'm curious, when you think about the approach that you and your partner are taking to this practice, what did you have to think about or rethink or clean up with regards to data, as sort of a building block in order for a technology like Agentforce to have any kind of lasting impact? If you catch my drift, like
Yeah.
what did you have to kind of rethink as a fundamental building or set of building blocks to make the approach work?
Well, I mean, I've been a part of some startups in my life, and
Hmm.
this is the only one where I went to a graduate school and said, "Hey, I want to have the rigor of going through," and that meant I had to go find out what was happening in the market. And so we
Yep.
really looked at medical practices, not just inside of chronic metabolic disease, but other medical practices as well. And I
Hmm.
deconstructed them down to their component parts on the clinical side, from both a medical and a behavioral health perspective. And then we looked at all the administration and all the things that happened kind of on the non-clinical areas of the patient and provider experience. Then we looked at the payer experience, and we looked at the system experience, hospital systems. And then I had to go take a look at all the things that were happening outside of metabolic disease. Like, what do we know about behavior change from substance abuse? What do we know about, preventing, infectious disease, and what do we learn in that part of the world? And I kind of looked at all these things and said, okay, if we were going to deconstruct all of this down to the smallest levels and then rebuild the experience that would work for the patient, that would work for the provider, that would work for the payer, that would work for the system, like, how would you have to rethink all of that? And the answer is, for us, you put the patient and the provider at the middle. Like, that's the key relationship. And then
Yep.
you serve those relationships with everybody else. And that means you have to be fair to the payer, because you've got a payer who's taking, risk, and you've got to be fair to the system. You have doctors who want to get paid and hospitals that have been built. And so how do you do that in a way where you really fix the problem for everyone, not just
Yep.
fix the problem for one stakeholder group? And that's what we did. And so we
Mm.
tried to do it so that you didn't disrupt, the important work that people are doing in primary care or
Right.
endocrinology or cardiology, but you built it up so that everybody was uh, engaging differently. And technology is a big part of that, but technology is not the focus. Like, you don't hand technology to a patient and say, go fix this problem yourself. You use
Yeah.
technology as the catalyst to reduce administrative overhead for the provider, to make things accessible for the patient where that's safe and responsible, to help the provider where it's safe and responsible. All those things can happen, and it's changing, how quickly it can happen, but you still have to have all of the right protections, clinically speaking, for reasons I think are pretty obvious.
Yeah, it's so true. It's spot on. I mean, when you think about what we're really concerned about is outcomes, right? And it doesn't matter if you're talking about patient outcomes or a production line outcome or a retail sales number outcome. You're talking about an outcome that has meaning and significance, either to a business, a P&L, to a patient prognosis. What is the outcome? And I think that's important. You just said you're anchoring on, which is you already rattled it off, right? I think the amazing outcome that you've seen in blood sugar performance, A1C performance. over dramatically compressed timelines for that pool of patients. I think you mentioned 50 patients. Now that's an outcome. That's an outcome,
Right.
a bottom line type of outcome. And I'm curious if you rewind from that outcome and you look at some of the enablers, some of which are technological, right? Agentforce as an example. Um, it, I'd like to maybe look at what exactly is Agentforce doing in its swim lane. In other words,
Yeah.
there's a fair amount of automation. There's a fair amount of semi-autonomous workflow, but there's also still dependency on human clinicians that are probably still irreplaceable in one way or another. Um, but if you sort of rewind from that outcome, which I think is the thing that matters the most, what is it that Agentforce is contributing to that outcome? If
Yeah.
you follow.
I think they're the things that people talk about with Agentforce that are being talked about front and center. Like they have
Yep.
agents, they have data connectivity, they have like these are the things that are being talked about regularly. I
Yep.
think the hidden story is
Mm.
that Agentforce has allowed us to grab things off the shelf and utilize them. They're being
Yep.
talked about. It's
Hmm.
also allowed us to bring our own AI and develop our own technology without becoming a technology company in
Mm.
places that we don't expect other people are going to be developing technology. So when we find a gap, we can have all of that play together really nicely in one platform. And
Yep.
then in an environment that exists today where technology providers are jumping ahead, then jumping ahead, then jumping ahead. We're not actually tied into a platform with one particular model for AI. We can actually go with one model and then unplug it, plug a new model in when there's a new development and it's very, very lightweight for us to do that. So we can be a medical practice, not a technology company.
Yeah.
Salesforce can be our partner and provide this environment that is so much more friendly than,
Yeah.
we built 3 technology prototypes before we actually chose Salesforce in
Wow.
early days. And then we evaluated all the different technology on the market. And when we lifted the hood on Salesforce, it was so far and away an easy choice for us because we didn't want to be a tech company. We wanted to be a company. We wanted to be a medical practice. And
Yep.
Salesforce is allowing us to do that. We still have an EHR. We still use, all the typical stuff, but Salesforce has allowed us to bring all of these other kind of things they're being used in healthcare besides just us. Obviously, Health Cloud's a very large endeavor for Salesforce, but it allowed us to really dive in and go fast. And so that was the thing that made it an easy choice for us.
Got it. No, that's great. That's great. And one of the things also I've studied a little bit about your journey is you have some ambition. You have some ambition as far as scale for, and you keep me
Mm.
honest as far if there are numbers behind it. I have some, but they're probably not right. But in terms of where you'd like to see Precina Health going is, you want to help as many people as possible. Let's put it that way.
Yeah.
And I think that's admirable. There are challenges in every business when you think about scale in the millions and billions, which I think
Yeah.
is well within your ambition, I think. And I think Precina is operating in 3 states, if I'm not mistaken, at this point. You keep me honest.
Lots more now. So we've
Okay.
added a couple since then. But yeah,
Okay.
that's
Fair.
right. We're
Fair.
so we're
Yeah.
adding states all the time.
All the time. So I guess the question then, even more so, is as you scale and you think about efficiency and you think
Mhm.
about productivity in every angle in your business, thinking about volume of clinicians and productivity of
Mhm.
clinicians and payer relationships and trust that you need to develop within communities, et cetera, et cetera. What are some of the constraints that you're dealing with regards to scale? And is Agentforce helping you solve some of those constraints, or are they not all addressable by Agentforce? Or help me connect those dots, if you would.
Yeah, I think, one of the things that we really came out of our diligence on years ago when we adopted Salesforce was what do we do about things like HIPAA compliance and
Mm.
cybersecurity? And the fact is, Agentforce will spend far more on cybersecurity than we will have in revenue.
Yeah.
like they
Yeah.
like that. So I've got a deep amount of trust that they're going to take care of the things that a technology platform company should take care of.
Hmm.
Right. And so, and I feel really good about that. And so that Health Cloud offers us this amazing set of tools. Agentforce, offers this amazing way of interacting with, other vendors. So we can put all this together again, relatively easily. And for us, what does that mean? It looks like, how do we fix, billing and just the amount of work that goes into billing, or pre-qualification, your pre-authorization for some patients where you're going through and pre-authorizing people. How do you do things like, when we get to scale, we don't have this problem today, but, they've just rolled out some pretty incredible technology that even just does internal desktop support. And what I'm really excited about that is not to fruition in our organization yet is this kind of Slack first environment for our providers. So they're going to have less and less and less administration and more and more and more natural language with ambient scribing. That, like, the power of that becomes amazing. And I think we're closer than some people think to that. Like, we already use ambient scribing, but when we can get our ambient scribes talking through Slack to our entire data set and then
Yeah.
put that into our automated billing system with the appropriate humans in the loop, like, that's a game changer.
Yeah. No doubt. No doubt. No doubt. And you hit on something as well a little earlier about what Agentforce has allowed you to do and kind of stick to your swim lane, and they do what they do, and that's about speed, right? How fast you can go. And it's an interesting dynamic because in my line of business, I think every industry now has pretty much claimed that a lot of the old playbooks are no longer relevant when it comes to how long things should take. And that could be anything
Yeah.
from, deployment of technology or approvals or certification, whatever it is. It seems as though time is being compressed dramatically. A lot of it being enabled by what you just said, which is AI enabled processing that just sort of breaks the old mold. And one question I have is that in healthcare, and you know this obviously way better than I do. I'm not an industry expert in that space by any stretch. There are reasons to be cautious. There are reasons to triple check compliance. There are reasons to have clinical rigor around things. Those are
Mhm.
all, I would
Yeah.
say, necessary evils, you might say. And I'm curious, how do you balance the need for speed and also the need for caution? Call it just sort of like comes with the territory of being in healthcare. How do you balance those things? And do you buy into the notion that some of those old playbooks, they're still valid and need to stay valid because of the value that they bring and the governance that they bring to very sensitive information and where lives are at stake, right? How do you balance that? And is Agentforce, some of the agentic workflow, is that helping in that area as well?
Yeah, I think, I would say balance is a really interesting word. I don't know that I am interested in balance when it comes to things like patient safety or data
Uh,
security, or like
yep.
those are areas where, now data security, like I've been a consultant where I've seen practices that have had breaches and I've had to parachute in to help with that. But like, I met one technologist early in my career who came from the tech world, and his attitude was like, we can release a bug and we'll just fix it later. I was like, no, this is a clinical bug. Like, we don't do that
Yeah.
here. Like, that's like absolutely not. And so I think, with AI in particular, there are going to be places that the human should be in the loop for a very, very long time.
Mm.
And that's just not only required by law
Yeah.
appropriately,
Yeah.
but it's also just prudent. And so
Yeah.
again, you'll remember I said, like, the relationship between the provider and the patient, like, that's the center point for us. And
Right.
so
Right.
technology is a catalyst. It's not
Mm.
the replacement, it's the
Yep.
catalyst. And so technology for us is great where we can take new protocols and we can have that are communication protocols, for example, with our providers, and we can have them practice that with an AI without a
Mhm.
second human having to be involved in that practice.
Mm.
So it
Yeah.
makes it, nearly free. Instead of a manager or a leader getting involved and giving feedback, the AI can get in feedback in the practice of that protocol, and the manager can then do the final sign off. That's a
Got it.
great way to apply an AI, right?
Yeah. Yeah.
And so we're working in a world where we're going to have brand new clinical protocols for any provider that comes into our practice. So it's almost like a fellowship all over again. So there's
Mm.
tons and tons of training. And so in surgery, you have these skills labs, Well,
Mm,
AI becomes a skills lab for communication and for bedside manner,
got
essentially.
it.
And
Got it.
so it's a great way that's very low risk for us. But
Got it.
if you say, hey, I've got a system that's going to talk about what diagnosis a patient should have, like for us, that's out of bounds,
Mm,
right?
yeah.
So for an AI to jump in and say, hey, have you considered this thing? Not out of bounds to a provider, right?
Yeah. Yeah.
So for an AI to say to a patient, like, hey, here's some questions we can help you, craft for your provider conversation, not out of bounds, you know?
Right. 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 Interesting. Interesting. John, is it fair to say that rural and underserved communities is sort of at the heart of what you're trying to accomplish with Precina? Is that an overstatement, or is that pretty much where your heart is?
Well, I would say this when we went to design everything we did, we wanted to
Yeah.
be able to economically, feasibly serve rural and underserved communities. Because if you can economically be sustainable inside of the most difficult use cases in our
Yep.
environment,
Yep.
then you can go work anywhere. And so we
Yep.
absolutely designed everything, from a how we deliver the service clinically to how we communicate to how the economics work. Like all of it had to work in the hardest circumstances, and
Yep.
that's how we designed our protocols.
Got it. Got it. So then, in that context, would you say that what you've designed into it, what the thought you've put into that, do you think the barriers to entry by other folks, let's just say larger health systems or digital health startups or AI native competitors, do you think the barriers to entry are high because of almost like the moat that you just described? In order for it's not probably not easy to build an economic model that sustainably serves rural and underserved communities. Is think about it competitively, I guess, if you would. Is Do you feel like you have some distance between Precina and some of these other nameless potential competitive healthcare offerings?
I think the financial model is one piece of it. I think the
Yep.
bigger difference is our absolute willingness to meet stakeholders where they are. And that
Yep.
means that we'll meet the patient where they are, we meet the
Hmm.
provider where they are, we meet the payer where they are. And,
Hmm.
and so that probably is our biggest competitive advantage is how pliable we are
Hmm.
with if we have a payer who says, hey, look, I need this from you, but I'm already doing navigation with my nurse line. It's like, great,
Mm.
we'll just strip that part of the program out of ours, we'll let you use yours, and we'll strip out the economics part of that too. That way you're not
Mm.
double paying. So I think those are the kinds
Got
of
it.
things we'll
Got it.
do just to be super pliable with people. And
Yeah.
at the end of the day, it's like, how do you get a cost effective clinical outcome that creates real economic value for the patient and also
Mm.
for the payer, and then help the provider feel really good about it?
Got it. Got it. Now, in your role, do you have the opportunity to feed back to Salesforce as you guys are growing and scaling, potentially discovering use cases or discovering capabilities that you'd like to see from Salesforce? Are you able to feed that back to them? And have you seen that actioned? And tell me
Yeah.
about that feedback and that relationship.
I don't know if that's a loaded question or not. Yeah, I've got lots of feedback loops into Salesforce. I'm not sure if you knew the answer before you asked, but I do
No,
have a
no,
lot
I'm
of.
guessing. I'm just because I know how they do their voice of customer and all that. I'm just curious if
Yeah,
you're involved in it.
they've
Yep.
been they've been great. Like I've been a part of
Yeah.
several different customer advisory boards. I have a lot of
Yeah.
relationships. A lot of
Yeah.
their product and even general managers that I've got relationships with have been very curious. And on a relative basis, we're a small company for them.
Yeah.
But
Yeah.
we were the first company other than Salesforce itself to roll out a couple of their AI products. Like they picked us out of 135,000 customers,
Oh, wow.
and we've been able to give them feedback about like, hey, here's what's working well, here's what we think you need to improve, and then they are so good about making those changes and improving things. And
That's
so
great.
it's been real. And so now I'm challenging kind of our, we have technology people we work with in our company. It's like we've got to stay up and keep up with them. Like they're
Yeah.
really moving in all the best ways like a startup. And so it's really fun to see a technology company of their size moving with the nimbleness that they
Yeah.
are. I'm really
Yeah.
inspired by it.
That's what you want. That's what you want in a partner for sure.
Yeah.
That's great. That's awesome. Good stuff, John. Let me, we're already nearing the end of our time. So I'm gonna steer us a little bit towards a couple of dismount questions, you might say, which I think are quite interesting. And one of those is your own personal experience
Yeah.
following some of Precina's own protocols. And You had a pretty good set of your own outcomes, if I'm not mistaken. Can you tell us a
Yeah.
little bit about that?
So a lot of this research that I was doing was during the pandemic, and I was working a full-time job while pursuing a doctorate at a very, very fast clip. I ended
Yeah,
up, gaining 50 or 60 pounds. And
yeah,
I looked at my partner, and, he kind of looked at me and was like, I'm not like following my own advice here, am I? He's like, no, you're really not. And so I just decided to start doing all the things that we offer to our patients. And so I'm now down, 50 pounds, and
awesome.
I was a college athlete, and I'm not as strong as I was when I was a college athlete, but certainly as strong as I've been at any other point in my adult life, and not
Wow.
with like a massive. I don't work out 7 days a week. I don't like.
Yeah,
It's not an all encompassing fitness is every moment of my life type of thing. It's like just
yeah,
really good, solid habits. But it's
yeah,
time to get there. I'm 2.5 years into that journey from the peak of my, unhealthiness, and my energy level is great. It's great for time with my kids. My youngest son has asked me to start playing pretty high level competitive table tennis doubles with him. So I'm now taking lessons to
oh my
play
gosh.
tennis, doubles, table tennis. He's very good, and I've got to catch
Yeah,
up. So, but
yeah.
it's great because I have the energy to do it, and I feel really good about it.
Oh, that's inspiring. That's great. That's I think I think we can all relate to that on some level, but that's fantastic. That's fantastic. Um, in another physical activity, and again, keep me honest. Are
Yeah.
you a practitioner of the art of karate as well?
Yeah, I studied martial arts for a long time and was teaching
Yeah,
for a long time, and it really was great. I can't remember being in a fight ever,
yeah,
but the discipline of a couple things, just
yeah,
disciplining your mind, and
yeah,
then learning about the efficiency of the body. The
yeah,
body moves efficiently and most efficiently in a certain way, and I got to meet a lot of great martial artists along the way, a lot of different styles, a lot of different philosophies,
yeah.
but it really helped me to understand discipline and efficiency in ways that were certainly spilled out into other parts of my life.
And has that, I mean, tell me about how that's shown up in terms of the Precina journey, how you've conceived of the business, and so that discipline, the idea of, progress, and is that shown up in how you've sort of thought about building and growing the business of Precina?
Maybe not so deliberately, but
Okay.
when I was teaching white belts, children in particular, some of the
Mm,
best learnings I ever had were from people who were brand new to karate, who had never didn't know what to do or how to move, and they would do things that were really threw me for a loop. And then you had to go meet those people right where they were to help teach them. And
yeah.
so that kind of small nuances and the focus on fundamentals, and my instructors were so good about like my first lesson in karate ever, I had to walk 10 steps along a sidewalk and then walk backwards 10 steps and then walk forward 10 steps, then walk back. And for 2 hours, all I did was walk forward and backward 10 steps. And they were
Wow.
testing me to see if I was going to be, kind of worthy of acceptance into this school. And I'm really grateful for the people that taught me. And so it's really helped me have a lot of acceptance and empathy for like, how do I go meet someone right where they are?
Yeah.
But also hold the line at what's going to work. Like if someone's like, hey,
Yeah.
I want to get better, but I want to have a pound of sugar, it's like, hey, I hear you, and
Yeah.
we just need to
Yeah.
have a conversation about that, and then you choose what you're going to do, and I'll support your path. But
Yeah.
sugar, like processed sugar, is not going to help.
Yeah. It's like when I tell my teenagers, it's, you can make any choice you want. You just have to live with the consequences of those
Yeah.
choices.
I have a friend who watched me have a Coke the other day, and I'll drink one Coke a month or something like that. And he was
Yeah.
like, "Wait a second, what do you?" It's like when you have enough, when your body is healthy, it has a lot of tolerance for that type of thing.
Yeah.
It's when you have 6 Cokes a day that you lose that tolerance and things start to tumble. And
Yeah.
so I just explained to him like I've kind of earned it over a period of time, and so I'm not a
Yeah.
teetotaler. I don't think it's like no sugar ever, or a specific diet has to be the answer. I think everybody's got to find the path that works for them,
Yeah.
that aiming toward the goal they want for their health.
Yeah. Yeah. You've uttered a phrase that I love, and you tell me if I've gotten it right, and it's called radical incrementalism.
Yeah.
And I'd love to hear kind of what is your definition of what that really means, radical incrementalism.
For us, it means making just the tiniest of changes to help change the inertia. So when someone is
Yeah.
stuck, how do you help get them unstuck? Let me tell you a couple real stories about that.
Yeah. Yep.
we had someone who was really stuck. And so they weren't ready. They had gone through, we'd gotten all the medicine right, but they weren't ready to change diet and exercise. And we're like, hey, no big deal. Let's just float this idea. What if all you did was change your coffee creamer to a different coffee creamer you liked? And just that changing coffee creamer had an impact on blood sugar, and they still enjoyed the taste of it, and that made them willing to change the next one thing. And so I tell people all the time, if someone's eating Captain Crunch for breakfast and you say you've got to move to kale and carrots, that's too big. It's too
Yeah.
big a leap. If you've been sitting on the couch for 10 years running a marathon, too big a leap. Like, let's just have you walk to the mailbox.
Yeah.
And so we had a patient who walked to the mailbox and called me. He's like, my knee hurts.
Yeah.
So what happened? He's like, well, I turned to the left on the way back from turning around. And so we worked through it for a few minutes. And I said, do you have a cane or a walking stick? He said, sure. I said, can you plant it in this particular way when you turn around tomorrow? He said, sure. I got a phone call the next day. He's like, I walked to the mailbox twice. It was amazing. No pain in my knee. And so it's just those, but you have to take the time to really get down to what's getting someone stuck. And you have to help them through it. And pretty soon that person doesn't need that kind of help. So people think, well, I couldn't offer that help to every patient every day for the next 30 years. And you don't have to. You just have to help people get unstuck.
Yeah. And then it's sort of like a momentum, right? That picks up from
Yeah.
there. Yeah. Yeah. No, that's really impressive. John, that's great. Let me ask you, in your put your professorial hat on perhaps, and what advice would you give? We've got a lot of people who join this community that listen to the podcast, a lot of different ways that we engage with the world. And a lot of them are folks like you, they're CIOs, they're CFOs, they're smart folks running companies, and they're trying to figure out what bets they should make to keep pace in this world, this enterprise AI, hypercharged, hypervelocity world. And they're trying to figure out how to navigate. And you've described a pretty healthy relationship you've got going with a company like Salesforce, which is obviously paying off for you. But I'm curious, like, if you were to get the ears of a couple of these folks, what would you advise them? Anything on any level, based on your own experience?
I can tell you what I talk to my team about and what I'm
Yep.
passionate about myself, and that is learning. Like
Yep.
I think that, as much as I think I've learned in my life, I've got so much more, like I'll never know enough. And so for me, I think I need to, as a leader, model learning. And so I spend a little bit of time every day trying to learn something. And I think that, we had a pretty fundamental shift in the industrial revolution when information came in the internet age. I think that was a pretty big change in the world. I think you saw something similar to that when the printing press was kind of created, is my guess. I think we had that in the industrial revolution in the first turning of that. I think we're in one of those places right now where this is going to be one of those inflection points where, like calculators or personal computers or the internet, like things are going to change pretty radically. And so I want to make sure that I don't get, swallowed by that wave. What I'm doing is learning about, like, what does that mean for, as a leader, AI on the org chart. And so I'm really focused on how AI gets used in the org chart. I think for us right now, the way we view AI is, in particular, how are we looking at it on the org chart? I think we've got to stay ahead of it. I think it's gonna end up on an org chart where people are using AI like a computer or a calculator, but they're going to be running processes. And so you've got, agents that are doing work on their own. You've got assisted workflows, and then you have just, places where you can go to the AI and get an answer to kind of speed up your work. And I think all three of those things are going to be developing even more significantly as we go forward. I think some businesses are going to have AIs that are running, entire parts of their company through automation.
Right.
So I think understanding not just what the work needs to get done, but how we monitor and audit the work to make sure that it's being done properly, in the same way that we monitor interns in a business, especially if those interns are getting mission critical work. The circles that I run in, we talk a lot about treat this like the smartest intern you can imagine, with all of the relevant experience of an intern who's never worked in your industry. And so, and then if you expect them to be, the AI to be better than most humans, but not perfect, because humans aren't perfect either, you're going to get a pretty good result. And so I think that the opportunities for us to accelerate are going to be really, really great. People ask if I'm worried about, is AI going to replace jobs? And I think in the long term, we're not going to have a problem as a society. In the short term, certain people are going to have a problem. Like there are people that their work will be displaced if they don't learn and grow. And we saw this in the agricultural, renaissance of the U.S. in the 1800s, where 90% of people in the U.S. worked in agriculture in the early 1800s. 35, 40 years later, it was much less. Today, it's about 1.5 to 1.9%, depending how you measure it. We're okay as a society. The problem is the people that were in the 90% in the early 1800s. And so I think for those people, my message would be thoughtful. Like it may take retooling of the career, but for society, I'm fairly bullish.
Yeah. No, that's very insightful, John. No, I think it's great. It's I told you I have teenagers. I'm giving them very similar advice. It's almost like when you're trying to decide what fields of study are going to be worthwhile, what careers are still going to be around in 8 years, 6 years. It's thoughtfulness and it's discretion and it's learning and it's figuring out. At the end of the day, there are fundamental skills that are always going to be valuable when it comes to critical thinking and problem solving and whatnot. And I think what AI, to your point, what AI is going to do is take care of a lot of things that perhaps entry level jobs used to do, right? Perhaps, but to your point, they need governance, they need inspection, and they need sort of that trust but verify management approach that you described. So, but again, the bar is moving so fast, it's hard to predict. It's really hard to predict. But anyway, John, hey, this has been awesome. I'm inspired personally and professionally by what you've shared. I really admire what you're doing with Precina on so many levels. I know this is going to be valuable to our community, so I hope everybody, if you have comments, please share them with us. Share them with your peers. I thank you again, John, for joining us. I thank you, everybody, for listening once again. We will have another episode tomorrow, Friday, to round out the week. Until then, thank you for being a member of our community. Thanks for listening to Enterprise Edge, and we'll catch you next time. Take care, everybody. Bye-bye.
Thanks, Mark.